sincere thanks to Mr. Srinivas, Mr. Anish, and T-Hub for giving us an opportunity to establish our clinic and becoming health partner for such young and talented and innovative people in T-Hub. My name is Sridhar and I've been in healthcare space for the last 25 years, predominantly in oncology. I worked as Chief Operating Officer of Vasudha Govinda American Cancer Hospital for 10 years and as CEO of Omega Hospitals. These two are oncology specialty brands for Omega also for 10 years, and then with the help of few like-minded doctors, we have started Renova Hospitals in the year 2018. Mr. Anish was asking me, did you wanted to start a hospital right from beginning? Did you wanted to be an entrepreneur? I said, right from the time I finished my Masters in Hospital Management in 2018, 1998, I wanted to start a hospital. But unfortunately, at that time, we didn't have a platform like this. So I had to work 20 years hard to create my own equity and also to create confidence among bankers to fund me to start my own chain. So this actually proves how lucky all of us are, this generation people are, to have a platform like T-Hub, which encourages you to become entrepreneurs and live your dreams so early in your lives. So briefly to tell about Renova Hospitals, we are right now 6 hospitals, 5 in Hyderabad and 1 in Jaipur. We are working in 3 segments. One is mid-level multi-speciality, the second one is oncology, and third one is fertility. Coming to mid-level multi-speciality, we feel that the peripheries of Hyderabad do not have good hospitals. Therefore, we are trying to concentrate on peripheries of Hyderabad and create boutique 75 to 80 bedded hospitals, which will have technology and doctors on par with any corporate hospital. This will not only save time for people living in the peripheries, but also the treatment cost will be much less, since these areas, most of the people are from middle and lower middle class background. Then we are also working in the area of fertility, because could be change in lifestyle, could be change, late marriages, whatever is the reason. We see that young couple today, most of them are finding it really difficult to become parents. So that is one area we really wanted to work and help people. And the third main area, which will be our major focus going forward, will be oncology. The reason is one, I have myself worked in this space for the last 20 years, and also as a disease, oncology is increasing a lot day by day. It's going to become huge going forward. So therefore, we thought it's our responsibility to work in this space, especially in Tier 2 and Tier 3 cities. Therefore, starting with Hyderabad, since we come from this place, we are now expanding into Tier 2 and Tier 3 cities, mostly in North India, because that is where there is huge gap between supply and demand in terms of oncology. And since today we are sitting in T-Hub, I would like to end by saying a few things about how technology can help healthcare. As we all know, as Mr. Srinivas also said, Hyderabad has become medical hub for India, and India is becoming medical hub for the entire country, entire world. But unfortunately, there are few areas which we still need to work to become more prominent in the global space. One of such area is definitely technology. When I started my career in 1998, it's only the bill that used to come out of the dot matrix printer, but most of the back-end work was done manually. And I knew how much of pilferage and other issues were happening because of non-availability of MIS and software at that point of time. From there to today, we have developed a lot in terms of non-clinical technology. Today, everything is automated in terms of billing and finance and other non-clinical aspects. But coming to clinical aspects, the technology used is almost minimal. Now, the reason could be two things. One, see, it's all about human being when you talk about hospitals. So, for example, if somebody comes to me and say, we have analyzed 50,000 ICU patients, and then now we have a technology which will help doctors to prescribe medication or prescribe treatment based on the software we have developed, depending on this data. No, it's not easy for the doctor to accept upfront, because there is a human angle to it, and also there is a fear angle to it. because it's about life and it's about the certification. If something goes wrong, the doctor will lose his certificate. So that's one major challenge the technology is going to face in healthcare. The second major challenge is again in terms of training the clinicians, because doctors will work very hard, 12, 14 hours, they put their time into all this, and then you have to make sure that the technology that you're going to develop should be very user friendly. These two are the major areas which we need to concentrate. And I think it's more about soft skills that you guys need to develop in terms of making doctors accept the technology. If you can work in these two areas, definitely I think technology is going to play a major role going forward in